Um, I just want to spend a bit more time on male infertility, especially male sperm issues, and this video will dedicate a little bit of time to what we deem as signaling issues. When we talk about signaling issues, what we mean is that in order for the for the testicle to produce sperm, it needs to receive the right signals from the brain. And these signals are in the form of hormones that traveled into the bloodstream, into the testicle, stimulate it to produce sperm and also produce testosterone. And then that testosterone then will feed back and essentially regulate how much hormone or how much signaling is produced by the brain. So there is actually a constant two-way communication between the brain and the testicle. When this communication is awry or it goes wrong, then sperm production and hormone production in the forms of testosterone production in the testicle is stopped. Just to be clear, in people with signaling issues, the issue does not lie in the testicle. The testicle is completely normal, but it's just not stimulated enough to do what it needs to do. Essentially, it is a dormant or sleeping testicle. The signals that the causes of signaling issue are either congenital and structural, so there is something inherently wrong with the central nervous system or the part of the brain that produces these signals that it hasn't developed properly and therefore no signals happen, or it's functional. And functional is more rare as a cause, so extreme stress can cause this. Some forms of severe eating disorders can cause this, but mainly we're talking about congenital causes of structural anomalies and issues with development in that part of the brain. The part of the brain that we're talking about is the hypothalamus and the pituitary, so the part of the brain that sits just above our nasal plates or just above the nose. And these produce hormones that stimulate the testicle to produce both testosterone and sperm. In people who have congenital issues or genetic issues, we see these problems fairly early on because of the lack of testosterone. These people don't actually undergo puberty. So they don't undergo a growth spurt, they have very sparse hair, their voice doesn't change, and the maturity of the testicles is not there. The treatment for this is to either replace the signals that the brain lacks or to replace the end product, which is testosterone. And which pathway you take really depends on what is your aim. In people who want to induce puberty and also induce fertility, then replacing the signal is actually what you need. Now, we can't replace like for like because the signal luteinizing hormone is not really, we're not able to produce it in the amount that the body needs. So we replace it with a similar hormone called HCG, and over months and months of these injections, then the testicle gradually wakes up, they undergo puberty, and then eventually sperm production kicks in, and they can sort of, under the treatment of these injections, they can go about relatively to try and have a normal sort of fertility journey. Once their families are complete, then we actually switch tack and move straight onto testosterone replacement therapy rather than replacing the signals. And the reason for that is that the only way we can replace signals is essentially injections, and in the case of not needing more sperm, using a lifetime worth of injections is pretty impractical, and giving testosterone therapy will have all the health benefits apart from the fertility side of things. So using testosterone replacement therapy is the best way forward once their families are complete. Now, what we talked about as causes of signaling issues is still relatively rare as a cause of male infertility, but one cause of signaling issues is becoming increasingly common, and that is actually testosterone usage or usage of anabolic steroids. That we will talk about in another video because that is a little bit more complicated than what this video would allow.